by introducing a brilliant initiative, Prana, which is introduced, and we have our guest today, Dr. Maria Nigam, who is going to be coming in and telling us about the 6-week-old baby that she and her co-founders have created for the purpose of COVID relief. And doing this as the two pilots, the Bombay pilot and there's a Bangalore pilot. So welcome, Maria, and thank you so much for coming on our show today.
Good morning, everyone. And first of all, enormous thank you to Deepa for really giving Prana this chance to become a torchbearer on your finale show. And to everyone who's tuning in, thank you. If I can just start with talking about my journey this far, it's been about 32 years since I graduated from medical school, but several ups and downs molded me, got my values strengthened and my dreams realized. And you can see a large part of this, all my experiences that have gone into Prana in its entirety. So started off as a full-time homemaker and mom to my two lovely daughters in Canada and then in India. And then Father Joe just roped me in to join Kripa as their medical director. And there was no turning back, supported him with his capacities in his HIV program, as well as worked in substance abuse in Dharavi. And the culmination was getting a shelter going for the street children addicts in Dharavi, which is really still close to my heart. And as Deepa mentioned, my motto, if you can do anything, do it now. So over the years has always been in reaching out to the marginalized and underprivileged wherever they may be. We are founders for Action Against Hunger, working with malnutrition in children, urban and rural India. I've been advisors to the parish clinics, again with the underprivileged population there. And finally, the go-to physician and counselor for all my close family and friends, and keeping me on my toes there, as well as doing what I love most, improving health outcomes for everyone in need.
So Maria, thank you for that introduction. I'm going to dig in a little deeper with that. So Maria and I, again, serendipity, and then you say nothing happens by chance. Minal Jagtiani, who also many of our school friends know as Bina, co-founder of Lead Think, sitting in Singapore, writes me this mail telling me about Prana and Dr. Maria Nigam's work. And promptly we discover so many connects. There is Dr. Om Srivastav, who we had interviewed in Just Lok some years ago, who leads the COVID task force, who is one of the co-founders and also a Prana behind Prana in a lot of ways. Right, Maria?
Absolutely.
And there are other friends and well-wishers who are part of this journey. And I'll take a minute to tell you why plasma was so top of mind and the reason I jumped at this opportunity. We lost a very dear friend 2 months ago in Hyderabad, a young man. And we know that when he was in ICU, there was a clamor for trying to get plasma. Which he did, of course, with a little anxiety for the family, but he didn't make it. And I come from a family where blood donation has been a very big part of, our ethos. And my father has been a card-bearing member of St. George Hospital. He's got all these letters thanking him for his ORH negative blood group that he's been a donor for. And this is why blood is something I understand, and prana, which is plasma, is something that I want to understand. And with me, I think all of us, and to listen to what is Maria's call for action through it. So we will learn and understand, learn from her some powerful experiences in her journey as well. So Maria, you have done so much of your work with, you're a gold medalist pathologist by training and education, mother to a doctor who understands medical fraternity, and you've come at this juncture of your life when you really come to the essence, so to say, which is the, so tell us more. How
Yes,
did this, what was that momentous day 6 weeks ago when you said, I'm going to do this?
absolutely. So when COVID landed at our doorstep, locked up at home, there was little I could do except mobilize donations for Nair Hospital, Tata Memorial Hospital in PPEs and masks, keeping everybody safe, healthy. But one fine day, early July, I receive, like your friend, an urgent appeal for plasma. And I just could sense the urgency, the anxiety in that family member's text. And when I spoke to him, and of course, activating the network helped. We got that bag organized, and then getting in conversation with Dr. Srivastav over this, we realized that there is just so much more to be done to not only meet the demand for plasma, but take away the stress on family members who, I had a family member even call out to me from his own hospital bed saying, arrange something for another family member in the ICU. So, that kind of anguish, I don't think anyone should go through in getting what is a therapeutic agent. That should be the purview of the blood bank system, voluntary groups like ours. And that was the moment, I said, we just have to do more. And Prana was born. So, as I said, we have Dr. Om Srivastav, our leading beacon, the father of plasma therapy, even though he says he wants to be just the father of his two little ones, leading this initiative with us. His sister Soman, a veteran social worker and an absolute pillar in on the ground action, as she calls it. Chaitra Chidanand, who is our backbone and flesh in the back-end tech support to make Prana an extremely tech-enabled matching system between donors and recipients. And of course, my sister-in-law, Dr. Sunita Lobo, who's leading the Bangalore chapter and doing marvelous work there. And last but not the least, our two lovelies, Melody Vaz and Sohani Guha, who have put together all our creative efforts. A big thank you to this amazing team and for bringing Prana in the 6 weeks to scale up the way we have. And we've just going to be in a few days, going to be partnering with the Federation of Blood Banks in Bombay, and deeply grateful to Dr. Zareen Barucha and all members for, supporting us on every front. Thank you, everybody. Yes.
Congratulations. And that's a lot that this baby of 6 weeks has accomplished with a very, very, very powerful intent, I think. And when we spoke, and we've spoken thrice already, Maria, you spoke about how you want this awareness to be as much as blood donation and as widespread as blood donation. That's how you see the vision.
Yes. So I'm looking at really scaling up Prana to at least have 100 bags of plasma donated through the month of October. We do face several challenges in this journey already thus far, and what I see for the future. And one of the main things is the misconceptions and fears around plasma donation for the donors themselves. I'm not surprised, each and every donor, you've gone through an excruciating journey, just learning that you were COVID positive in itself, then recovered from it. And here we come asking you to be of service. But remember that there's absolutely no fear in donating plasma. We've had donors donate this week, 2 of them, even for the second time. The donation process itself is just 30 minutes, but on an average with the testing and screening could be even 3 hours. So extremely grateful to our donors who've sometimes even taken the day off to come and donate plasma. And now I let one of our double plasma champions, who is also now a Prana warrior or a volunteer with us, tell you more about his experience.
Yeah, so let's have that video about the amazing experience from our donor. And, I think hats off to him and to his family. So maybe we can have the video of the Prana warrior being aired. My team will do that in a moment.
Yes. And
Yeah, so I think it's coming on. Can we go back to the beginning? Yes. Can we have a full screen, please? Yeah. Can we have the sound? Thank you. Why can't we hear? We're not able to hear the video. We would like to hear the speaker. So can you fix that in a bit and come back, team?
okay.
There seems to be some issue. So sorry about that, Maria. I
No
think we
worries.
figure
No
out what's
worries.
happened
Yeah.
at the back.
Yeah. So if we go back to the challenges, and our donor here would really take away all the fear and the worry of getting COVID-19 again. You know, donors are already at a level where they have an antibody titer, which has to help another patient. So their immunity, you know, would work to prevent them from ever getting COVID-19 again. All blood banks, and even if they are standalone or in a hospital setup, have the strictest of guidelines in terms of hygiene and safety.
Yeah.
And there's nothing to worry about that. And if I can take you to the second part, where even though we have lakhs of recovered patients, and even us in the Prana donor registry, we do have to weed out almost 20 to 30% because they don't meet the very strict eligibility criteria by which a donor is selected. And that would mean that those over the age of 60, those underweight, under 55 kgs, or women who have ever been pregnant would not be able to donate. So even though we have this large population of recovered patients, let's say over a lakh in Bombay itself, we still have these screening criteria, which brings down the total pool to a fraction. And that again is a challenge to build up our donor registry. I just want to take you through our video on the eligibility criteria. Sorry.
What we can do is we can show the video, the patient video first, because I think
Sure.
let's show that, and then that will give a context.
All right,
So maybe
absolutely.
we can have both, first the patient video followed by the second video on the eligibility, please. Can we air that?
double plasma champion for this and also a volunteer now. He's actually made this video all by himself and sent it to me yesterday to use. Yes.
Amazing. And he's a young person. So truly your prana warrior, Maria.
Absolutely. Absolutely.
And maybe we should see the second, you want to show the second video now?
Yes, please. On the eligibility criteria, just to give you a glimpse, these are all not part of the screening processes, but at least a pre-screening process that Prana carries out. And then a huge screening process and safety measures are taken over at the blood bank to make sure that the plasma that's transfused is absolutely safe.
Yeah. So there are two videos that are there. So they're just 1 second, Maria. Maybe I can, should I just send it? I also have it with me.
Ayushi has it as well.
So maybe if I have video screening rights, I can just, I don't have video sharing rights, so I cannot share it. I don't know whether Ayushi.
I sent it via email to you.
Yeah,
sorry,
yeah. Of course, and it's there on our comms desk as well.
Okay.
So I had sent this to comms desk yesterday. I don't know why this is happening. I've sent this again to the comms desk via WhatsApp. So.
Would you like me to?
No, she says she's sharing it. She's got it. I send it over WhatsApp. So we're ready. Yes, please.
Thank you. Thank you. I can't hear you.
Very, very well made. I said really well made. Compliments to the team. Both. This one actually makes it really clear. And if you visit the website, you'll also see how easy it is to access the form. I've done that, so it's really, really simple. The backend is strong. You really got a strong tech backend because you're trying to do a whole matching program. And how's this pilot? How long have you planned to do this pilot, Maria? What are your plans?
We plan to take this pilot all the way till October 1st.
Okay.
Because we are really looking at building a very, very robust donor registry. As I said, we've come in the 45 days up to 60, but I really would like to even triple that and take it at least to 200 by the end of this month. And in the eligibility criteria, if you observed, a very important one is the timestamp, and that requires Prana to be on their toes to identify donors who are at 14 days post their COVID negative test or 28 days post recovery of all their symptoms, is when studies suggest that the antibody titers in their plasma would be most useful to a potential recipient. So that is another thing that Chaitra at the back end, she really tracks it for us. She has it all color coded, so we know which are the donors to contact first because they're closest to that date. And a second part of this pilot this month is going to be able to match the recipient registry automatically with the donor registry. Once we have it robust enough, the two processes would get matched.
Mhm.
And then by October 1st, I think we would be ready to do a replication of this model on a pan-India basis, which is the action point of Prana, on a pan-India basis to make plasma universally accessible to all, any hospital, any patient, anytime. So this is what we are working towards. We've just started Plasma on Wheels, where plasma is moving intercity already. And Dr. Lobo in Bangalore has organized 2 bags to get from Bangalore to Mysore. Uh, we are collaborating on a pan-India basis with blood banks who will believe in our model and are on the same page as us. So Mangalore and Pune are shaping up, and very hopeful to connect in Indore and Bhopal as well this week. Um, and coming back to the tipping point and the recipient, the whole purpose of Prana is to make getting that bag of plasma by the recipient easy, comfortable, stress-free, and leave it all to us. And just focus on getting your family member better or yourself better on that hospital bed. So leaving you with a few thoughts on how you, each and every one of you, can help Prana do this. If we could have that slide from the PowerPoint play up, if it's possible.
Even before they put up that, I just wanted to ask you a couple of questions. So we
Sure.
will show that slide twice, in fact. So if they put it up, let's look at it once and then we'll go back to it towards the close of the session to take a look at it again. Yes, so this is Prana. I love your logo.
Thank you so much. We have Melody Vance to thank for it. We just did it together one morning in July. My rock and pillar giving me that little sip of water. He's discovered that my throat, my lips are drying up.
So this is the Prana pledge that Maria wants us to know that. So this is October 1, I think that's a typo there. So I will sincerely work to motivate potential plasma donors and get at least one donor for till 1st of October. So that's what the pledge says. We will have that corrected and put it up again. Uh, Maria, I just want to ask you that in the last 6 weeks, were there times when you felt, what did I got myself into? I mean, like this is just consuming me like crazy, and am I up to it? Have you felt like that anytime, Maria?
Yes, I have. Um, I have, but then realized a minute later that this is just what I want to do. Just build up prana. This is the vision that I have for plasma, getting to each and every person. I do believe that plasma therapy could work, even though it is in the experimental stages. I do believe that it is an option that must be explored uh, by physicians. I absolutely respect their decisions, but why not give it a shot as well? Since everything right now to address COVID 19 at whatever phase a patient presents is in a trial and experimental basis, except for dexamethasone, which we have the recovery trial to actually say really reduces mortality rates. So, truly, all clinicians and physicians do think about it at an earlier stage. Even though they're observational trials, they do tell us that it works in the moderate stages. Don't reserve it for, once for the time when you've already used up everything in your arsenal and when on the ventilator and critical. Do consider it at the moderate stage itself. And let's hope we have the outcomes greatly improve, and us at Prana give you that source of plasma, the liters of plasma that I really want flowing this month. Um, and as I said, talk, each and every one of you in the audience. I hope I've given you a little glimpse of how safe donating plasma is, that you can't get COVID-19 again. So talk to each and every one of your family members and your friends, and especially if there is a recovered patient in your midst, tell them more about it. Encourage them to talk to us at the Prana team or visit our website, learn more about it, and really, really try and get at least one donor registered with Prana, each and every one of you, so that we can get these bags flowing. I have to tell you that a bag of plasma can be preserved all the way for 1 year. So if we have a donor at the stamp of 28 days, all it would take for him is to come and donate it, and we can keep it even up to a year to help another patient, rather than wait for a later stage when antibody titers could possibly have waned off and you wouldn't be useful to another patient. So if you are on the fence thinking about donating plasma, jump off it right now and approach us so we can save more lives together.
You know, there's a bunch of well-wishers complimenting you and your work, Maria, and especially the pace and the time at which you've got this uh, initiative off its ground and running. There are some questions over here. So side by side, I'm going to. So I have our torchbearer, Dr. Divya Mittal, who does some amazing work in Bombay, saying, life-saving work, Dr. Maria. A big hand of applause. I want to donate my plasma. That's what she's writing.
Oh my gosh. Yeah.
Thank
Yeah,
you, Dr.
thank
Divya
you.
Mittal. Thank you so much. Then I have Sunil Rajadhyaksh asking, I heard they can only take convalescent plasma from women who have never been pregnant. Is that so, and why so?
Okay. Really good question, Dr. Rajadax. Thank you. Um, when a woman gets pregnant, there is an exposure to her husband's antigens, and that kind of builds up a different set of antibodies in her, which we call HLA antibodies. And if we have plasma from a woman who has ever been pregnant, and we transfuse her plasma into a recipient, these HLA antibodies can cause what is called a transfusion related acute lung injury. We call it TRALI as clinicians. And that's something we just don't want to happen to
What
a
do you call it? Sorry, what do you call
call
it?
it TRALI,
Okay.
TRALI, so TRALI.
Yeah.
And in COVID 19, as you know, we have a great deal of lung compromise. So we definitely don't want this chance, even though it's 1 in 5,000. We just don't want Charlie to be a chance. And that is why, unfortunately, I've had many lady friends be adamant about wanting to donate plasma. You can donate blood for us, and it could be useful in more ways than one. But unfortunately, you can't be a plasma donor.
So men and women who've never had a baby,
Never been pregnant.
never been pregnant, sorry. Oh,
Never been pregnant is important, even if it didn't result in a successful pregnancy. And so, never been pregnant. Men in the age group 18 to, I would cut it off even at 55, because then we have issues with comorbidities like hypertension, lung disease, kidney disease, diabetes that again preclude you. So, want healthy men to come forward and really give this bag and save a life.
so there's also another question over here from Ayushi Sahai, who's saying, does a donor need to carry their COVID reports when going for donation?
Okay. It's mentioned in the eligibility criteria. And yes, thank you for that question. You do need to carry your COVID positive report with you. But in our talks with the Federation of Blood Banks here in Bombay, and even Dr. Lobo will in Bangalore, we are not insisting on a COVID positive report, even if you don't have the COVID positive report, but you've been symptomatic in that entire list of symptoms: a fever, a cough, loss of smell, taste, diarrhea. Um, if you have suffered from symptoms and then gone through your recovery phase, and then the clincher in donating plasma is something that the lab decides. Once Prana does a pre-screen of your data, which we receive through the form, we present you to a blood bank that is closest to you, because your safety and comfort is prime to us. And the blood bank will draw a sample of blood and test for what is your level of COVID antibodies. And that is the game changer. That will decide whether you are a fit donor or not, along with a whole battery of tests, which are the normal screening tests we do for any other blood donor. So if you meet the cutoff of that particular blood bank, you become an eligible donor. And again, I want to insist that it is the 28-day timestamp after you have recovered, or 14 days after a COVID negative report, where you would be, your bag of plasma would be most useful to a recipient.
So Naomi wants to know, and both of your daughters are here commending you and for your work. So she's asking, what do you say to those who might be reluctant to come forward to donate plasma? And how do you increase the confidence level for those who are hesitant? I think it's a great question because we can never repeat enough on its safety. So I think maybe once more.
Absolutely. Uh, Plasma donation is totally and absolutely safe for the donor. If we are talking about getting COVID-19 again, there is next to none the chance of getting COVID-19 again, because you have your immunity at top level. Uh, Other processes are all conducted in the blood banks with attention to the highest safety and medical standards. So the medical procedure itself is absolutely safe for you. It's comfortable. We have a fabulous set of doctors in the Federation, both here in Bombay and in Bangalore, who make the process so comfortable and easy for you. It takes just 30 minutes to donate plasma. You just feel a little pinprick, and then you're lying down. And in most cases, most of our donors enjoy talking to the doctors, making this video, sharing it with Prana. Superbly grateful to all our donors for this. And I think an important part of stimulating donors to come forward over the fear is also that feeling that I'm going to save a life. I
That's
mean,
so important.
how much better than that can life be in this pandemic, with all everything that seems to be going wrong? I am here saving a life. I mean, I don't think anyone can have a better feeling than that. And that has been repeated over and over again by each and every donor in a message, in a video to us.
Yeah.
So go after that, I would say.
Amazing. So Harinakshi Mistry is asking you, how do you generate the funds? Is there a way to donate to this initiative? So this person has found an alternative to the plasma that she cannot donate by asking you this question.
Thank you, Harinakshi. I know her as Cookie, so I'm going to say Cookie. Thank you so much for that. At this time, we've just managed with our in-house resources, but really grateful for this offer. May have to take you up on it. And even if we have, and if we have a need, we'll definitely reach out to you. But thank you so much for the offer.
Yeah, so probably here's an opportunity to maybe set up something like a non-profit, or if the non-profit probably have a place where people can donate.
Okay.
because you never know where that's going to lead and how big the need is going to be. So thank you for that, Harinakshi. Sunil Rajadhyaksh is asking, if an eligible donor registers with Prana, where will the plasma donation be done?
Okay. Typically, once a donor has been pre-screened by us, we try to match the donor to a blood bank in the vicinity. In the early days, especially in Bombay, when we were in ICMR trials, we had a restriction of just Nair Hospital and HN, where were locations where donors could go and the plasma could be harvested. But as of today, I believe we do have up to 14 blood banks all over Bombay who would be are licensed to harvest plasma. And hence we give the choice to the donor. We tell them that, this is the blood bank that is closest to you. Would you like to go there? Or we have at this time 4 blood banks in Bombay, which offer what is called off-label plasma to each and every patient in each and every hospital. But Prana believes that if a donor is available, that bag of plasma has to reach the recipient in whichever hospital they may be, uh, no matter how far away. And we have seen donors rise to this occasion, even on a Sunday, whiz across the city to make a donation to save that life. And again, superbly grateful to them.
Amazing. So there's CA Rajendra Soni saying, I request Dr. Maria Nigam to let us know how we can get associated with this drive. We in Jaipur frequently arrange blood donation camps, so we can be of some good role to this cause. So guide us. So that's what they want to know. So what we're going to do is at the end of it, you'll have a link to the Prana site. You will where you can write them. You can be in touch with them, and we are going to be having some of the questions that can't be answered. Maybe they'll go on to a place where these can get answered as well. So thank you for asking that. And you can partner with people in different cities once the pilot is done, right?
Absolutely. We are actually sending out our proposals. Today it's going to Indore and Bhopal. And happy to send out the proposal because it could go back and forth. The hospital management is involved in a big way.
Yeah.
And yesterday I shared with you, Deepa, a form. I think a
Can we
very,
do that?
very
Yeah, maybe we can just show them the form once.
absolutely. And while I tell you, Prana's emphasis is on obtaining donor consent, absolutely respecting your confidentiality and privacy, and only taking any step with your complete permission. So, in that regard, I have contacted hospitals and their managements and heads of department to tell them that in order to build up our donor registry, I don't want your patient names and contact numbers because that's something we haven't taken their consent for. Instead, please circulate our consent form,
Yes.
motivate the patients on the day of discharge or the day before, talk to them a little about plasma donation, and get them to sign our Prana consent form, which will then give us a chance to contact them, motivate them, and have them donate plasma at the 28-day timestamp later on. We also have a WhatsApp message which has an inbuilt link in it, which I encourage everyone on this platform. We can have it accessible to you to spread in your network, and it just takes 2 to 3 minutes to fill up that form. I just like to take a moment to also discuss a little bit on the recipient side, because Prana believes in adhering to the highest medical and ethical standards.
Yeah.
We have a very strict recipient verification form,
Yeah.
both on our website as well as a WhatsApp message, where where the doctors, we get in information which which has the patient details, but more importantly, has the prescription of the attending physician.
Yeah.
Because one of the challenges we are facing is that perhaps a physician in all good faith has mentioned to the family members that plasma is required,
Yeah.
and then they push every button in their network, and
Right.
we get the request. There is no prescription as yet, and then we are trying to accede to a request which has not yet been prescribed. So we are particular that every verification form has this prescription with it, and this hurdle, of course, will be overcome this coming month with our partnering with the Federation of Blood Banks, particularly in Bombay, because then we would be dealing with the blood bank officers in the respective hospitals. And as I said at the start, the idea is to have the recipients' families out of the process. We don't want to have you stressed out over getting this bag. We
Yeah.
want each and every blood bank in Bombay, Bangalore, or wherever it is we are working to be flushed with bags of plasma, ready to issue the minute a recipient request comes to us, and get all of the anxiety and stress over for the recipient's family.
Maria, there's a whole more bunch of questions, but I do want to point that there are two people who have said that I have recovered from COVID and that they would like to donate and they would like to donate convalescent plasma. And how and where can Prana arrange to take my plasma? So we are going to give you all the lists. You will see please visit the website of Prana as well. We are at the last 3 minutes of our session today, and I do want people to know that all of your questions, all of your energy, all of your enthusiasm, I think has really fueled and given even greater confidence. uh, Farhat wants to know, is there a long waiting list for recipients today? And there is also other questions, Maria, which say that how many people have we helped already? And there is another question which says, were you not able to help some people?
Okay. Good questions. As I said, our Prana donor database today is at about 60, just crossed 60. Of these, we have had 23 bags of plasma harvested totally between Bangalore and Bombay. So I have to tell you that we can harvest only up to 500 ml of plasma at a time. But what benefits a patient at a time is just 200 ml. The dose is just 200 ml. Some physicians would decide to give just 200 ml and follow it up with another 200 ml in the next 24 hours, or just stay with 200 ml. So 23 bags, you can say, have been received by 46 patients so far in this 1 month period. When we receive a recipient request, of course, the first thing we do is go through the registry and find out if we have an eligible pre-screen donor ready with us. And as I've said, they have risen to the occasion and rushed across the city and donated to help that request. We are also send out that request to each and every one of the blood banks in our own network. We are also part of a pan-India network where we help each other no matter which city in Mumbai, in India. We work to reciprocate with each other. And I would like to say that it is a massive collaborative effort. No one alone can work and accede to each and every request. So we have to work together and get those bags of plasma flowing. Excuse me.
So Dr. Maria Nigam, our torchbearer number 20 at the grand finale, with all of you watching in, I would like all of us to make that pledge that we will become spokespeople for talking about plasma, to do what we can to get more young people, more men also enthused and to join in this effort for the medical fraternity to look at it even as an option at the middle stage rather than waiting for it till the end stage, and for other cities to also partner with Pranapan India on having a collaboration and helping our healer, Dr. Maria Nigam, on her journey. So, Maria, thank you so much on behalf of all of our attendees, all of our Lumiere team, and all the donors and their families and the recipients who are inspired. Thank you and your team, of course. So thank you for coming here today. telling us, informing us, inspiring us, and please guide us on what we can do going forward.
Thank you, Deepa. Uh, just so blessed and grateful to be a torchbearer for Prana today and end and round up your torchbearer season. Thank you to Ayushi and your team for your support, your patience. I'm sorry I sent everything last minute to you. And thank you to each and every one of you for tuning in and watching in, and donors for signing up, uh, already. So grateful. Come be torches for Prana and let's save many more lives together.
Thank you. Thank you for that. Thank you so much.
Pleasure. Pleasure. Thank you, Deepa.
Thanks, everybody.
Thank you. Thank you.
Amazing. So we're going to send you all these good wishes. We're going to collect all of them and put them for you. Thank you very
Thank you,
much.
Deepa. And really happy to take any more questions. You can always write to us or even call me. All our contact details are on the website.
Yes.
Do
So
visit
all,
the website and learn more. A lot of information is there. And come be Prana warriors with us. We need volunteers all the time. So happy to sign you up as a volunteer as well.